Mary Kay Niehoff, and this is Employee Newsreel. I'm wearing red today in honor of Heart Month. Today we're talking about Club Red, our online community as a resource for women to live a heart-healthy life. We started this program 2 years ago, and in that short period of time, we recruited more than 4,500 women. On this website, we have heart-healthy recipes, Ask the Doctor, information about the latest research, and exercise tips. We've expanded this program to include a Club Red clinic, which we're going to talk about more in a little bit. But first, I'd like to introduce you to one of the women who has decided to share her story as an inspiration to everyone else. Her name is Rosemary, and she's a nurse in the dialysis center in Zion's Crossroads. So, as a woman and as a healthcare provider, do you ever find that you put others' needs above your own?
Taking care of others, I basically put myself second and them first. By doing that, I neglected basically eating wrong food choices, lack of exercise. Those are the choices that I made.
What changes have you made since that time?
Changes that I've made as far as cooking, we bake. My husband and I, we bake. We broil, we saute. Diet drinks as opposed to regular drinks. We've pretty much cut out sugar altogether in exchange for Splenda, and we both exercise locally instead of just basically sitting around home watching TV.
One new aspect of Club Red is the Club Red Clinic at Northridge. It's an opportunity to bring women together for a shared 90-minute appointment. This has many benefits. First, they have a 90-minute slot. They get in and out on time. The women are there that have similar heart risks, so they're able to ask questions, and maybe somebody will ask a question that they haven't thought of. And they see a range of clinicians in different roles, physicians, exercise physiologists, dietitians, so they're able to get a lot of information in a 90-minute concentrated period. As you can tell, right now, there's a shared appointment going on. In a little bit, we're going to talk with Dr. Tucker, and she's going to tell us a little bit more about this program. So can you tell us what prompted you to start this clinic in the first place?
Sure. With heart disease being the #1 killer of women, we wanted to be sure that we offered an increased range of options for managing cardiovascular risk factors and helping people implement important lifestyle modifications to reduce cardiovascular risk for the women of Virginia. One of the innovations in our clinic as applies to women's heart is that we are offering the option of shared medical appointments. Women tend to really like it. We use a multidisciplinary approach, so we have, in addition to the physicians that provide care, we have nurses, exercise physiologists, pharmacologists, we have dietitians and diabetic educators, and women who have come to our group visits have been very pleased. 100% of them have said that they would recommend a group visit to others, with 90% preferring the group visit over the traditional individual visit option. Everybody that comes to the group signs a confidentiality agreement, and people sign it at the beginning of each group visit, which protects the confidentiality of the other members of the group. I think one of the greatest benefits of this group medical visit paradigm is that women enjoy the connectivity with other women, sharing their stories, sharing their concerns, getting mentoring and advice from the other people in the group, and the group serves as a great source of support.
So that's a little bit more about Club Red and our Club Red Clinic. To learn more about it, go to clubreduva.com. And make sure to wear red this Friday, February 6th. I'm Mary Kay Niehoff, and that's Employee Newsreel.